Okay, so the healthcare system in Uganda is highly concerned about how the distributions of services are done in Uganda. For example, the organizations of the institutions like the hospitals within the healthcare system. For instance, the question is our, or maybe the Uganda healthcare system, is it centralized or is decentralized? Now, before we go further, then you need to understand the difference between decentralization and the centralizations of healthcare services. Now, decentralized healthcare services means that the services are scattered among the populations, whereby people in up country, for example, they have their services, they can get services from there. So if someone have problems that needs medical services, they visit those facilities that are near to them. Any problems concerns maternal health, they visit the facility near them and they get maternal health services near them. You don't need to come to, for example, Mulago to get a service that can be found in your localities or in your communities. That is decentralizations, like scattering the services centers within the countries and making sure that it is everywhere close to the people and is actually accessible. That decentralized what? Healthcare services. I think centralized healthcare services is, for example, having a service in one location. For instance, we can say that, okay, we are going to have a service in Kampala, and Kampala, so it means that if you have any medical problems, even if you are in which kind of village, you're supposed to live there, and then you come to Kampala just to get treatment for malaria, just to get tested for HIV, just to get the treatment for HIV/AIDS, all kind of medical services that you want. You're supposed to go to that one location. So that is centralized what? Services. Now, when you compare these two services with the Uganda healthcare system, you will realize that Uganda healthcare system are decentralized. The services are scattered, whereby, because anybody who is in Arua does not need to come to Kampala for just to get a treatment, a minor treatment. The services are there. There are health center 2, there are health center 3, there are health center 4, there are referral hospital, there are regional referral hospitals. Not until when there is a problem that it can't be handled at those facilities, that is when they can come to the national referral hospitals. You get, so the services in Uganda are centralized. Okay, so I'm saying that in Uganda healthcare delivery, Uganda healthcare delivery is done in Uganda through decentralized framework. So the district health structures is responsible for all the structures in the district except the regional referral hospitals where they exist. Okay, so this course units is just about introducing you to different services that are offered within the healthcare system, how the services are offered, and what types of services are offered by who, at what level, and what are their roles. You get the point. So for example, you may realize that we have different types of services. We have different types of services, like we are saying here that healthcare system includes the hospital systems, include types of patients care, includes the public health programs. So these health programs eventually is the concerns of the healthcare system. So we have the structures or organizations of the hospital systems, and we also have the organizational structures of the patients, how the patient is supposed to receive their services. For example, a patient who is having a minor problem from up country or anywhere in their localities cannot come to Mulago without a referral. What does it mean? It means that the services that you may need to come and get from Mulago will not be offered at your Health Center 2, Health Center 3, or Health Center 4. But the services that you need rather are found in your area. So the need for you to come to Mulago Referral Hospital would be when you need a referral or a specialties. So that's the reasons why many patients, when they go to Mulago without referrals, they are chased away, because that is not the primary center of service delivery. You're supposed to start from your Health Center 2 or Health Center 4, and if the problem can't be handled in that Health Center 4, you should be referred to referral hospitals. And if they find they cannot solve that problem, that's when they are the only one that have authority or the permission to refer a patient to the national facility. So the national facility, what kind of services are offered at the national referral hospitals, and then the services that are offered at Health Center 3, Health Center 4, Health Center referral hospitals are actually different. For example, when you go to Health Center 2, you realize that the Health Center 2 are actually headed by a nurse who has a diploma in nursing. Now, which means the services are limited. There is no doctor. But any person who needs a service that should be offered by a doctor should visit Health Center 4. You get? So that is how the services are distributed. So different levels have different types of services that they offer based on different qualifications. So that's the reasons why you start from the ground and then you progress to national facilities. So this to help you understand the organizations of the healthcare system and the structures. Now, we have the hospitals, and it starts from Health Center 2 to national referral hospitals. That is the hospital systems. What does it mean by system? System is the collections of components that work together to achieve a common objectives. So what are the collections of components? We have what are the collected components? I mean, we have the Health Center 2, we have the Health Center 3, we have the Health Center 4, we have the referral hospital, we have the regional referral hospital, and we have the national referral hospitals. So these are the collected components that works together to ensure that the people gets quality health care, people lives are saved. So those are the objectives of this system. And then types of patients, the patients we receive as varieties of categories. They're not the same type. We have different types of patients. For example, in the hospital we have emergency patients. Emergency patient may not be treated as outpatients or someone who need a Panadol for the hand headache. You get the point. So we need to categorize them such that we give priorities to people that need service the most. Although everyone have a right to access services, but there is a way that they need to be prioritized. Now, within this, we have public health programs. Now, public health programs include the likes of immunizations or vaccinations, distribution of mosquito net, maternal child health, kind of giving drugs, HIV treatment, tuberculosis treatment. There are various public health programs. So the healthcare systems are divided into three aspects: the hospital systems, the types of the patient's care, and the public health programs. Okay, so like I'm saying here that a hospital system is a group of hospital or facilities that work together to deliver services to their communities. Different types of hospitals have different types of ownership and financial goals. So basically, this is financial related to financial goals. So we have when we say that hospitals have different ownership, it means that some of the hospitals that are owned by the private sector, and then we have the facilities owned by the government. It's just like the schools, we have the private and government what? And government schools. So those are the ownership. So like we said, we have the public hospitals, which are founded and owned by the local government or central government, and they receive money from the government, and then they utilize those money. And those types of hospital or categories of hospital includes Mulago, Butabika, Rural Regional Hospital, Nebi, Mbarara, Lira, and all that. And then we have non-profit hospitals, and categories of what? Of hospital systems. We have non-profit hospital. So these are hospitals that offer services to the community, but they do not aim at what? Do not aim at making profit, and they are owned by religious denominations. And their main goals, actually, they also have the same goals of providing healthcare services to the people in the communities. And this includes the like of Lasho Hospital, Rubaga, Zambia, and Ngoli Hospital, Verika Hospital, and the rest. Those are the hospitals that are owned by the churches or by denominations. And then we have private hospitals, those which are owned by the investors, and some of those include many of the facilities that we know in Kampala here, basically. So in private facilities, they can actually have the same level as national facilities. So the private hospitals, these are facilities that are owned by investors and some of the nationals, and their goal is basically to earn profits, and they tend to offer also more profitable services, such as rehabilitation services, the like of plastic surgery, cardiology. They also try to avoid unprofitable services such as emergency medicine, because emergency medicine, you're supposed to treat someone before even your demand. So you never know, you may be treating someone who cannot afford to pay the money to pay the service. So they tend to avoid emergency medicine in their department because it's actually unprofitable. And then talking about the patients, like I said, we have also different types of patients. We have the primary care patients, we have the specialty care, we have emergency care patients, we have urgent care patients, we have long-term care patients, and then we have hospice care, and we also have mental health care patients. Now, this is also quietly explained here, and when you talk about the primary care, we are saying that this is the first place or care where a patient goes for medical care, the first place. So the patients may get their primary care from the clinic before they proceed to the hospital. They can get their services from anywhere. So the first point where a patient get the services, that's what is called the primary care. So some of the examples of the primary care could include the medical doctors' clinics, or maybe the general practitioners, the general interns, or some of the family doctors and other pediatricians, nurses, and assistants, and some other practitioners. They're part of the primary health care providers. And also we have specialty care. Specialty cares tend to specialize only on specific knowledges. So you find that there's a medical doctor who is concerned about the cardiacs, and that is the cardiologist. You find someone who can do better and works and helps women with their pregnancy and the problems related. That is a gynecologist. And then we have the oncologists, those who deal with the trauma and the capuses or the crucial concerns. So the specialty care are strictly services that deals with specialty problems. So someone will have to specialize. So if someone have a heart problems, you find that you go to heart clinic. So in Mulago, we have heart clinic. If someone having a high problem, you visit high department. If somebody is having bones issues, you visit orthopedics department. So those are the specialty specialty care. So it is about understanding those classifications or organizations of services. Okay, so yeah, so I believe that you can be able to go through. Now there is this word that I know you will come across is palliative care. Palliative care. So palliative care is basically services given to vulnerable people who have issues like mental instability. They have emotional problems, so they needed those services like home care, someone take care of them from home, providing the services or social support to those people. That can be done by the family members, can be done or by assigned nurses, to serve to people that are old. So we call them vulnerable groups. The pregnant mothers, they need such kind of special care. The old people of 65 or 70 and above, they need such care because they can't be able to do most of the things by themselves. So mental health care, of course, you go through that place and you summarize them. My application is not able to display the structure, but definitely you have a coursework there. Now, in summary, this course unit is related to the services, how the services are offered within the hospital and within the service itself. And you have things to do with like understanding health center 1, health center 2, understanding health center 3, what kind of services do they offer, and what kind of services must be included in in such level. And we have health sub district. Health sub district facility is, for example, if a district, the biggest hospital in that district, if it is health center 4, then that health center 4 represent, or it is called what? Health sub district. If the biggest facility in that district is a referral hospital, then those referral hospitals, but the health sub districts actually are those smaller health services that provide care under what? Under regional referral hospital and referral hospitals. Okay, and then we also talk about the leadership under those services. So here there is a referral facility and general facility, the leadership under those services as well. What is the roles of the Minister of Health? Those are things. And then the national referral hospitals, what are their roles? And then what does a complete health sector or health services should consist of? And some of the functions of the regional referral hospitals, what are their functions? So I believe that you can deal with that. But in case you have any question, you can tap on me anytime. So I'm going to send this to your WhatsApp direct.